Good morning, the lecturers. So, my name is Gajen Raja, and I'm from Group 4. And today I would like to talk about the topic Ascaris Lumbricoides. This is my group members. This is the geographical distribution of our country, of our nation. So, the colored area are shows the prevalence of prevalence growth rate of the Ascaris Lumbricoides. Geographic distribution. The geographic distributions of Ascaris lumbricoides are worldwide in areas with warm, moist climates and are widely overlapping. So this shows that the Ascaris lumbricoides are suitable to grow in most of the country in our nation. So infection occurs worldwide and is most common in tropical and subtropical areas where sanitation and hygiene are poor. Move on, each factor. Although ascariasis occurs at all ages, it is most common in children 2 to 10 years old and prevalence decreases over the age of 15 years. So this shows that the growth of the ascariasis lumbricoids are rapid in the childhood. So infections tend to cluster in families and worm burden correlates with the number of people living in a home. Infection rates for ascariasis have not been reported to be higher in patients infected with the human immunodeficiency virus. So, from this, we know that the people with HIV virus have the less number of growth of Ascaris lubricoides. The mode of transmission. The main mode of transmission is via fecal oral, which is known as alimentary. Humans are infected by eating eggs in soil contaminated by human feces. So it occurs mainly via ingestion of water or food, such as raw vegetables or fruits, in particular, contaminated with Ascaris lumbricoids eggs. Occasionally occurs through inhalation of contaminated dust. The children playing in the contaminated soil during their childhood may acquire the parasite from their hands. The transmission is enhanced by the fact that individuals can be asymptomatically infected and continues to shed eggs for years. So lastly, prior infection does not confer protective immunity. So that's all from me. Thank you.
Um, I am Grishalina Kaur from group number 4. Today I'll be presenting about the life cycle of Ascaris lumbricoides. First, let's see how the cycle begins. First, human is the definite host. There is no intermediate host in between them. The transmission is from human to feces, feces to human. The adult ascarids they live in the small intestine. The female ascarids it will produce 200,000 eggs per day. The eggs are deposited in the lumen. It is passed in feces and it must be embryonate for 3 weeks in the soil before it becoming infectious. The ingestion of infective eggs by another human from contaminated soil it will result in infection. After ingestion, the hatched larva will penetrate into the intestinal mucosa and will invade the portal venules. Finally, they are carried to the liver and they travel through the hepatic vein to the right heart and into the lungs. The larva enlarges and it will rupture into the alveoli and are coughed up and subsequently it will be swallowed. Upon reaching the small bowel, they mature into mate and deposit as eggs. If the infection is untreated, the adult worm can live for 12 to 18 months, resulting in daily excretion of large numbers of ova. The incubation period is prolonged. The interval between the ingestion of the egg and the development of egg-laying adult is approximately around 8 weeks. The life cycle diagram of Ascaris. First, the larva will mature further in the lungs. It will ascend the bronchial tree to the throat and it will be swallowed. Upon reaching the small intestine, the larva will develop into a adult worm, and the eggs can be seen in the feces. The eggs will be embryonic. Then the larva is released in the intestine and it is carried through the bloodstream in the lungs. Here next is the clinical features. Most people who are infected with Ascaris lumbricoides, they appear no symptoms. When the roundworm infestation grows, the symptoms become more noticeable. As we see in the lungs, when someone ingests the microscopic Ascariasis eggs, they hatch in human small intestine. The larva will migrate through the lymphatic system or bloodstream into the human's lungs. The person will experience signs and symptoms similar to asthma and pneumonia. They will experience persistent cough, shortness of breath, wheezing, fever, and blood in mucus. While in the intestine, the larva will mature into an adult worm in human small intestine. The adult worm will live in the intestine until they die. The clinical manifestation of partial or complete intestinal obstruction is nausea and vomiting, vague abdominal pain, diarrhea or bloody stools, anorexia, and also jaundice. If the large number of worms present in the intestine, the human might suffer from fatigueness, severe abdominal pain, vomiting. The worm will be found in vomit or stool, weight loss due to malnutrition. Here comes the laboratory diagnosis. First, let's see about the human ingestion. Diagram A represents the unfertilized egg, while diagram B represents the fertilized egg. Diagnosis of larval ascariasis. There are three steps, which is clinical examination, image-based diagnosis, and serological detection. For the diagnosis of adult intestinal worm, there is four ways, which is clinical examination, worm expulsion, serological detection, and also molecular analysis. Finally, for the diagnosis of fecal Ascaris eggs, there is two ways, which is coprological microscopy and molecular analysis. This is the diagram of Ascaris lumbricoides fertilized egg. The outermost membrane is covered by protein coat which has very thick shell. Let's see about stool test. The mature female Ascariasis worm will begin laying eggs. They will travel through your digestive system and they can also be found in your stool. To examine your stool for the microscopic eggs and larvae for 40 days after infected. Only the examined female worm will be examined and not the male worm, because the male worm, they won't have eggs. For example is flow-tech. Here is the diagram of flow-tech test. First step, they take 1 gram of feces and the feces will be added with 1 ml of formalin with a concentration of 5%. It will be homogenized. The fourth step, it will be added. The fourth step is add the flotation solution to reach 20 ml, which is ratio 1 to 10 sample dilution. Again, it will be homogenized. Filter and fill the two flotation chambers. Finally, wait for 5 to 10 minutes. Translate and examine it under the microscope. What is the meaning of homogenized? Homogenized is to make a mixture of two mutually non-soluble liquids the same throughout. This is achieved by turning one of the liquids into a state consisting of extremely small particles distributed uniformly throughout the other liquid. Now let's see about blood tests. In blood tests, there will be increased number of eosinophils. The eosinophils count is the highest during the stage of larval migration. An eosinophilia of 30% to 50% may be present. When the mature worms develop, the eosinophilia usually ranges between 5% and 12% and rarely above 25%. For example, ELISA, CBC, which is complete blood count. Finally is the imaging test. Imaging test, it consists of X-rays, ultrasound, CT scans or MRIs. For X-rays, if you are infested with worms, the mass of worms may be visible in an X-ray of your abdomen. In some cases, a chest X-ray can reveal the larva in your lungs. For ultrasound, an ultrasound may show worms in your pancreas or liver. This technology uses sound wave to create images of internal organs. Lastly, the CT scans or MRIs. Both types of tests, it is create detailed image of your internal structure, which can help your doctor to detect worms that are blocking the ducts in your liver or pancreas. CT scan, it will be combined with X-rays image taken from many angles. MRI uses radio waves and a strong magnetic field as well. Here are some pictures of the X-rays and also CT scan, if I'm not mistaken. Yeah, here's the reference of our presentation for listening to our presentation.